Lindsay. I'm a student nurse, and I am going to be doing my medication demonstration for you today. So I'm going to be giving methylprednisolone to my patient. My patient is Emma Wrightson. She is here she's getting this medication for her arthritis. I've already checked her allergies, and I know that she's allergic to morphine. I've already checked in her chart to see what fluid she has running and what rate. So I know she is receiving D5W normal saline, and that it's at a rate of 30 mLs an hour. So I'm just going to double check that when I go into her room. So I already checked that my physician's order and my MAR are accurate, so I'm good there. Just going to pull my medication from my chart, or my cart, and I'm just going to do my first med check. So Emma Wrightson, so it's methylprednisolone. So I have 125 milligrams in here, so I've already done the calculation after I reconstitute it that I'm going to be pulling up 0.6 mLs out of this container vial. So right dose, right route, IV, and right time is given every 6 hours, so it is appropriate to give this medication right now. So I'm just going to perform hand hygiene. Go. So I'm looking at my parenteral drug monograph here, just to make sure that my dose is appropriate for my patient. So it can be administered by a student nurse. The usual dose for a disorder other disorders it says, is 40 to 250 milligrams IV every 6 hours. We're going to be giving 75 milligrams, so it's appropriate. And then I'm just going to go to my reconstitution instructions. So for my vial of 125, I'm going to add 2 mLs of sterile water for injection. I'm just going to clean my lids here, my tops. Clean for 15, or clean for 30, sorry. Let it dry for 15. I'm gonna clean for 30.
We'll just go through
and just let it dry for 15. Alright, so I'm just going to grab my syringe here, weighing back my packages, making sure that everything is staying sterile. Same with my blunt fill here, just winging back my packages. So I am giving 2 mLs of sterile water, so I'm going to drop 2 mLs of air into my syringe. Inject my air to create a vacuum and withdraw my 2 mLs. Just checking for any bubbles, so I have 1 bubble here. Making sure I don't touch the needle and compromise the integrity of my sterile system there.
Hi there, my name is Sunny. I'm a student nurse here at the University of Manitoba. I'm here
just going to inject it into my medication here.
Our patient here, Wrightson. So before I got into here,
some air out.
Doctor's orders and compared it against the MAR.
I'm just going to do the scoop and swoop method.
So
place that at the side here. So I'm just going to roll this in my hand, making sure that there's going to be no precipitate left in the bottom here, so it looks good. I'm just going to check for an expiry date. And there is no expiry date on here. You're good. It's not expired, is what I mean. I'm sorry. So I am going to be pulling up, as per my calculation here, 0.6 mLs of my medication. So scoop and swoop here again. just going to show that to the camera there. So I have my 0.6 mLs. So I'm going to do my second med check here. So this is for Emma Wrightson. I have my methylprednisolone. I need 75 milligrams, so I had 125 in here. I further diluted it in 2 mLs of sterile water, and then I performed my calculation knowing that I need to pick up 0.6 mLs, which is what I have in my syringe. The route is IV, and I am going to be giving it every 6 hours, so it is appropriate to give. Put that away there. So if I look at my parenteral drug monograph for IV intermittent for doses less than 250, I am going to be further diluting it in 50 to 100 mLs of normal saline or D5W. So I have decided to go with a 50 ml mini bag because my patient does have a little bit of a fluid restriction. And then I'm going to administer it, it says to administer it over 15 to 30 minutes, and I'm going to administer it over 30 minutes because this is my patient's first time receiving this medication. So I'm going to carefully watch them for any of the side effects that I'm going to go over in a little bit. So I'm just going to clean the medication port here on my bag, clean for 30. Let it dry for 15. I'm also inspecting my bag. I'm looking for any precipitate in it, and I've looked at the expiry date, and it is not expired, so it is good to give.
Hi there, my name is Sunny. I'm a student nurse here at the University of Manitoba. I'm here today to give Wrightson to our patient, Wrightson. Before we got in here, I had a look at the doctor's orders for this medication.
Alright, so I am just going to place this into the sharps container here. I'm going to just kind of move my mini bag around just to make sure that it's fully administered or properly distributed throughout the bag. And I am going to make my medication label, which I've already made here. So my drug is methylprednisolone. My dose is 75 milligrams. My volume, because I put it into my 50 ml mini bag, is 50.6 mLs. My diluent is 50 mLs of the normal saline. My concentration is 1.48 milligrams per milliliter, and I will be running it at a rate of 101 milliliters an hour. So I'm just going to put this on my bag here.
Looks like we have 1 gram.
Just on the back so that it doesn't kind of block any of the important information on the front there. And I am good to go to my patient's bedside. So I'm just going to make sure I grab everything I need. So I'm going to bring a couple alcohol swabs just in case. I'm going to grab my mini bag. I'm going to grab my infusion set here with a label that I will attach. I'm going to bring my MAR, and just before I head to the bedside, I'm just going to look in my parenteral drug monograph for any potential hazards of this medication so I can educate my patient. So some side effects is going to be some sodium retention, edema, reduced resistance to infection, or increased blood glucose if they're on long-term therapy. So if they stick with it, these are things, stick with this therapy, this is his first time receiving it, these are just some things that I want to watch over time. Alright, so I am ready to head into my patient's room. Just gonna wash my hands. Hello, Mrs. Watson, how are you doing today? Awesome. So my name is Chelsea. I'm going to be a student nurse helping you out. As I walk into the room, I'm going to be doing an entrance safety check. So I'm checking my bag that it's the right bag that we have here and that it's not expired. I'm just checking all my tubing, making sure everything is open. I have no kinks in my tubing at all, and I'm just going to check my patient's arm IV site to make sure that they're not in any pain. Do you feel any pain? Nope, they're all good. Alright, so Miss Watson, I am going to be here today for your methylprednisone, so this is going to be for your arthritis. Do you have any questions about your medication at all? So the doctor has prescribed that you're going to be on this medication for quite a long time. It's usually just a lifelong therapy. So for methylprednisone, some side effects that you may start to experience over time is going to be some sodium retention, some edema, some increased decreased resistance to any infections, and you can experience experience some increase in your blood glucose level. So if you start to experience any of these, then you can just go see your primary care physician and they're going to help you out and we're going to take care of you. Does that sound okay? All right, so I'm just going to do my third med check here. So I'm going to take my MAR to my patient. Just looking, so Emma Wrightson, so the FIN number, looking to make sure that's correct. Yeah. I'm going to ask my patient if they can state their name out loud for me, and if they can state their birthday, and if they have any allergies. All right, so it looks good. I'm just going to double check with my medication here. So I have my methylprednisolone, 75 milligrams, 75 milligrams. We're giving it IV. This is for IV administration every 6 hours. So it has not been given yet. So it's in the right time frame. All right, so I am going to just take my tubing here. In the egg. Just gonna lower my bag here. I'm going to attach my tubing or my label to my tubing here.
So our order of 650 falls within the usual dosage.
And I'm going to make sure that my roller clamp is in the off position. So I am going to remove the cap here and the cap from my spike while maintaining sterility of both pieces.
Tells us how much sterile water we need to put into here to
making sure that that's good and fit there. And I'm going to turn my medication around. I'm going to grab one of my alcohol swabs here.
10.6,
and I'm going to swab the upper Y port because I want my medication to be regulated by my Baxter pump.
the tops of these with an alcohol swab, so control the risk.
So I'm going to do the same. I'm going to clean for 30.
Microorganisms.
Let it dry for 15. I'm just going to take off my cap here. Maintaining the sterility of both pieces.
So for the interest of time, we'll say we did this for 30 seconds.
Attached there.
And let it dry.
So now I'm going to be back priming my medication. So
first
I'm
thing I'll
going
do
to
is,
open my roller clamp and slowly lower my bag below the primary here. And what I should start to see is the air in the tubing just start to rise up here into my drip chamber. There's just a couple more air bubbles I just want to get out of there.
Okay, so now I'm going to
It's a little too full. I'm just going to place this back up here. I'm going to make sure that I set my secondary, so I will be setting it at 101 milliliters an hour here. And we are giving 50.6 mLs. So I'm going to confirm my secondary. And then I'm going to just press start to set that. So this is going to run over 30 minutes. And then after this is done, my primary is going to kick back in. So I'm going to be standing here watching, making sure that I see 3 drops.
I just need to add 1 milliliter.
Okay, I've seen 3 drops.
To get my 5.
And I'm going to go and I'm going to document that I have given the medication. I'm going to talk to my patient and let her know that I'm going to be back in about 10 to 15 minutes just to make sure that this is infusing nicely. And then after the medication is done infusing, I'm going to come back and check that my primary bag has kicked back in.